Mary-Louise McLaws, who is an advisor to the World Health Organization, who joins us now from Sydney. Mary, great to speak to you once again. What is going wrong?
Well, you've got three fronts of this pandemic down in Melbourne. You've got a number of cases that were in large family clusters, and they kept on giving it to other large family clusters because of a lot of cohesiveness between the community. Then we've got outbreaks over 100 in residential aged care facilities. And the issue is and it's been the same in America and other places, when a resident at an aged care facility gets sick, if they aren't moved out to hospital, then it's a domino effect and the other residents will get it. And of course, we've seen in places like China, 80% of a family will come down with coronavirus if a positive member of the family is kept there. And aged care is similar. It's a family of elderly people sharing a house that's not purpose-built as a hospital. And then we've got some healthcare providers that have got sick and we think they've acquired it in the community. So they are trying very hard to rein this in. They've done a lot of testing. The numbers are still going up, but not as fast as they were before. So it looks like the addition of the face mask will help slow down. One other problem has been, for some reason, when people have a test done, which is great, they're turning up for tests, but then they go shopping or go to work. Now, they need to stay at home until they get their results, but at least in public, now they'll be able to wear a mask and keep their germs to themselves. And then the final problem is that some people aren't taking the phone calls from the human contact tracers. And the human contact tracers are behind time all the time. They've got to get to people to assess their exposure within the first 3 days, because as soon as somebody starts becoming infectious, then you get second generations and third. So it's a big ask. And when you've got over 4,000 cases in the last 14 days, it's a tremendous challenge.
Indeed. And Mary, when do you expect those numbers to come down?
The government believes they'll be able to get it down in another month. And I think that is hopeful. But with people wearing a mask, which is the first time ever in Australia, there's been great models done now to show that even if a mask is only efficacious 50% of the time for, filtering out virus particles, both exhalation and inhalation, it can reduce the reproductive number significantly and getting it down to 1. So I think this is a very good step, making everyone wear a mask.
And is there any indication that the numbers are so high because you're in the middle of winter right now?
Look, we are in the middle of winter, but many other countries are suffering this as well. It's really a behavioural issue rather than potentially temperature and relative humidity impact on the virus. People in wintertime go indoors. Australians are used to having beautiful temperature like you have in Turkey. But when it is very cold, people go inside and they don't keep social distancing. Australians are not very good at that. And then, of course, if the airflow or the air change isn't very perfect, then, of course, it keeps the particles suspended in the air for longer and susceptible people can breathe it in. So it's behavioral, we think, more than temperature and humidity response to the virus being able to live, except when people are working potentially in meat and abattoirs, that temperature and low humidity may play a part in keeping the virus suspended and alive for a bit longer.
Mary-Louise McLaws, always a pleasure to speak to you. Thank you.